Hey guys, I'm Kayla Taylor and welcome to Kayla Tailored Wellness. My name's Kayla and I am a family nurse practitioner that specializes in integrative medicine. So what that means is not only do I get to help patients traditionally in a healthcare clinic, but I also get to treat them holistically using vitamins, supplements, and herbs. So today I want to discuss nausea and review what causes it, how I would work it up, medications I treat it with, and natural ways to treat nausea. But before we get started, smash that like button and hit the subscribe button for the YouTube algorithm. So just remember, I am not your healthcare provider. I do not know your allergies. I do not know what medications you are taking, and I do not know your past medical history. So please use this information you gathered today to have an educated conversation with your healthcare provider. So there are many causes of nausea. That would include intestinal infections, alcohol intoxication, food poisoning, motion sickness, emotional upset, pregnancy, gastrointestinal blockages, medication side effects, and migraines. So because there are so many causes of nausea, I have a huge differential of what is causing this nausea. So we have to work it up in the clinic. I would first start with the urine, and if it is a young menstruating female, I would get a urine pregnancy test, but I would also get a urinalysis to rule out a urine infection. I would then check their blood and do a CBC, or a complete blood count, and that would look at any signs of infection within the blood. I would also do a CMP, which is a complete metabolic panel, and that would look at the electrolytes in the blood, because sometimes electrolytes are lost if they're having vomiting or diarrhea. I may consider ruling out a pancreatitis by checking an amylase or lipase. I may check a thyroid lab. I may consider some ultrasound or CT scan of the abdomen, and even do some gastric emptying studies to rule out a gastrointestinal blockage. My first line medication I would go with is a serotonin antagonist such as Zofran, otherwise known as ondansetron. Another option are dopamine antagonists such as Reglan. The side effects of Reglan could be extrapyramidal symptoms if you use it over a long period of time, and so that could include involuntary muscle movements, muscle spasms, restlessness, and tremors. An additional option would be the group phenothiazines, which includes compazine or Phenergan. But again, these also have those extrapyramidal symptoms and sedation as a side effect. The risk that if we don't use medications and the nausea is left untreated could be dehydration, because they're losing too many fluids when they're vomiting, and even electrolyte abnormalities, because they're losing the salt and potassium chloride when they're vomiting. This could lead to cardiac arrhythmias or alkalosis. So there are lifestyle ways to treat nausea. The most important one is your diet. So you want to avoid high-fat foods such as pizza or hamburgers, spicy food such as salsa, acidic foods such as tomatoes or citrus, very sweet foods such as cookies or cakes, and odorous foods. So you'll want to eat high protein foods, low fat foods, salty foods since you lose salt if you are vomiting, and bland foods such as bananas, rice, applesauce, and toast. You also want to avoid having an empty stomach. That will make you more nauseous. So as soon as you start feeling slightly hungry, eat a snack and get some food in your stomach. The contrary of that is make sure you don't eat large meals. Make sure you're having small, frequent meals so you're not stuffing yourself. And finally, light to moderate aerobic exercise has been shown to decrease nausea in pregnancy. A great alternative to medications would be ginger. It is very safe in pregnancy. So you can take 500 to 1,000 milligrams of ginger every day. It has shown to have a 5-fold improvement in nausea and vomiting in pregnancy. And it also helps with gastric emptying. So it helps move the food from the stomach down into the intestines. Ginger also helps with chemo-induced nausea and seasickness and has comparable effectiveness to Dramamine, but can take up to 3 days to get to the full therapeutic effect. So although the next recommendation is slightly controversial, it is cannabinoids, and it has been found to be as effective as dopamine antagonists like Reglan in treating chemo-induced nausea. You could also try chamomile, 500 milligrams twice a day. So it works as an antispasmodic to help the intestines relax, allowing food and gas to be passed. Chamomile reduces nausea in chemo patients, motion sickness, pregnancy, and irritable bowel disease. Peppermint is an antispasmodic and anti-nausea, so it can help reduce intestinal spasms in patients with irritable bowel syndrome and decrease post-op nausea and chemo-induced nausea. So you can use 1 to 2 drops of peppermint essential oils on the back of the neck or the bottom of the feet, or you can use 5 to 10 drops in a diffuser. You can also add 2 to 3 drops on a cold compress and place on your forehead. Just remember, ingesting peppermint oil can help with nausea, but it can relax the esophageal sphincter, allowing for food contents to easily come up the esophagus. So lemon has been shown to help nausea in pregnancy. So you can either use lemon essential oils in a diffuser, you can cut a lemon and actually just smell it, or you can ingest lemon juice. I personally use this little bottle called Motion Ease. I keep it in my purse for when I'm in a long car ride and getting motion sick. So what you can do is use 1 to 2 drops behind the earlobe every 3 to 5 hours. And some of the ingredients include lavender, peppermint, chamomile, and frankincense. A safe and alternative treatment for pregnancy-induced nausea would be vitamin B6. So you could do 10 to 15 milligrams every 8 hours for 5 days. But please speak with your OBGYN on this option. Vitamin B6 can also be found in fish, poultry, avocados, and spinach. The most safe and convenient way to treat nausea is with the P6 acupressure stimulation. So there is a brand called a C-band that also puts pressure in this area, but you can do it anywhere, anytime without buying anything with just your fingers. So this point is located right on the wrist, 3 finger lengths below the wrist crease, in between 2 tendons. One is called the palmaris longus, and the other is the flexor radialis. And so you will put some circular pressure in between the crease of these 2 tendons. You may feel some discomfort, but overall it should help resolve your nausea. A 10-minute foot massage, a back massage, or ice massage can help chemo-induced nausea. Progressively relaxing every muscle of the body can also help chemo-induced nausea. And finally, using guided imagery, which is where you imagine your happy place using all of your senses, can help reduce chemo-induced nausea. All right, so that's all I have for you guys today. Please follow me on Instagram at Kayla Tailored Wellness. And comment below, let me know what has helped your nausea. And check out my description below. I do have a link to competitively priced supplements. And thanks again for watching and letting me tailor your wellness.